After widespread condemnation and an online petition with tens of thousands of signatures, the suspension of paediatrician Dr. Tim de Meyer has been withdrawn. Last month, he penned a sobering open letter detailing what he called the horrendous conditions of the Rahima Moosa hospital here in Johannesburg, where he works. Dr. de Meyer spoke of power and water cuts, broken equipment and shoddy infrastructure, to having to drive around to other hospitals trying to acquire essential supplies. He was placed on precautionary suspension yesterday, but only after the Provincial Health Department met with hospital management, and Dr. de Meyer, the move was rescinded, and Dr. de Meyer is reportedly back at work. For more on this now, Professor Haroon Saloojee is the Wits University's Head of Community Paediatrics, and he joins us from here in Johannesburg. Professor Saloojee, thank you so much for joining us this evening. I'm going to assume that, much like us, when we heard the news that Dr. de Meyer was suspended after writing that really powerful open letter, that you too were unfortunately not surprised by the action taken by the Department of Health, or, from what we've now found out, by the CEO of the hospital. What was your reaction when you first heard the news?
In fact, my initial impression was I was quite dismayed at the situation. I thought that since almost 2 weeks had passed, that there'd be some developments. And as I said, I was quite dismayed to see that this particular action had been taken. And then when I thought about it, actually I became quite angry about it. And I think that's been a reaction for many other health workers around the country as well. The nature of the reaction is not what we were anticipating. So, no, it wasn't what we were anticipating.
I suppose I say that just because when Dr. de Meyer wrote that letter, obviously he was inundated with requests for interviews from broadcasters, from media, members of the media, because he wrote so frankly and so powerfully about the day-to-day challenges that he faces, that if you know people who work within the system, who are health workers, we also know that many who have spoken up before, perhaps not on such a public and national platform, action has been taken against them. Many of them have been blackballed. And it's not the first time that somebody has faced suspension for speaking up when they felt that that was the last resort that they could face. Do you agree that that is perhaps the perception out there?
Yes, so I think you are correct. I think the health authorities are known to be vindictive in the actions. But I think why I was anticipating something different is because of the nature. It involved children. The discussion was about such basic aspects of healthcare that one would have thought that the natural reaction would be to respond to that particular crisis, and certainly that 2 weeks later then to have the vindictive behavior that, as you said, has been past behaviors of health authorities was somewhat unexpected and disappointing, as I said.
We had
not a complete surprise.
Yeah, absolutely. A statement, a very powerful statement sent out by the Progressive Health Forum, amongst many other organizations in your field who spoke out very strongly as soon as this news hit. So many healthcare professionals also speaking out on various platforms in support of Dr. Tim de Meyer, including his colleagues at Rahima Moosa Hospital, who stood up dressed in black today and posted that they were in support of him. Now, the Progressive Health Forum says that these suspension was an act by petty officials of the department, and of course it's now come out that it was a decision apparently taken by the CEO of the hospital as well, and only then when there was action from the Premier David Makura, who is quoted in the Daily Maverick saying on Thursday night, "I'm waiting for the report from the MEC on this matter. I will never approve any act of intimidation or victimization of professionals and workers who speak out where things are going wrong. We need more such people in the public service." Now, while the Premier's statement is pretty powerful and something that you can hold on to, it must still then be quite frustrating that those who work in the health department don't seem to agree with the stance of the Premier. Where does that leave professionals such as yourself and your colleagues and the many interns that work under you in terms of who they feel should back them as they go about their very difficult work every day?
Yeah, so clearly in the conditions that we work under, we recognize that the health authority, including the Gauteng Health Department, is very clear that they want minimal complaints from doctors, that there's always the threat that if you go to the media and not get permission from the hospital, you are a threat of action, as was taken with Dr. De Meyer. I think what's come out from this whole episode is that the attempts of the health authorities to muzzle doctors and other health workers on such a basic kind of problems is not going to hold. The reaction from the public, the reaction from the health workers, there were statements by almost 7-8 different organizations, very different organizations, from SAMA to the Samatu to the professional associations like the like the Anesthetic Association, the Paediatrics. It really, I think, perhaps surprised the health authorities how strong the view was about this. And I think this has opened a whole new era that many of us are going to be much less scared about taking on the health authorities and exposing the dismal situation in our hospitals, simply because we know that we're on the righteous path. This is not complaining about doctors' salaries or nurses' salaries or about work conditions. This is about our patients, in this case children. And so a door has been opened, and I think we'll find increasingly health workers being willing to make their moral distress and their discomfort with what's happening more clear. So I think this is a quite precedent setting.
Absolutely. And the frustration was quite palpable in that letter in, itself. I mean, in the letter, Dr. De Meyer said, yes, before you ask, we've gone through the proper procedures. We've raised these issues with management repeatedly. There were 2 reports on the critical state of the neonatal wards and obstetric services in 2016 already. Letter and report and meeting after meeting, and still nothing has happened. I think, Dr. De Meyer, and I'm sure you, the last thing you want to be are martyrs. But at the same time, the people that you spend your life's work trying to save, little people who cannot speak for themselves, they are the ones that suffer. What now happens next? Yes, you now feel like you've got agencies to speak up, but what you really want is for action to be taken, and so that you have just at least the basic services so that you can continue to do your jobs.
And I think that's the disappointment about the reaction coming 2 weeks later, because we really had a sense that, recognizing how wide the public outrage was, that the health authorities would do the reasonable thing, which is beginning to address the problems at Rahima Moosa for starters, but also other hospitals in the area. And so the fact that after 2 weeks the response we get is the response we've had is very, very disappointing and in fact disgusting. The issue you raised then is, so how do we go forward from here? And this has been the issue throughout. Gauteng Health has some excellent practitioners, people who are passionate about the care they provide and are very willing to make the changes that the system needs. But for some reason, and particularly academics within the Johannesburg, the Wits area, have been ignored deliberately. We haven't been able to get a memorandum of understanding between Wits University and the province. And so there are good people out there who are more than willing to assist the provincial authorities to start making the kind of changes we want. We're not just demanding various things. We are saying we are part of the solution, and to have that ignored is disappointing. So perhaps the fact that the premier of the province has recognized this, and that the MSC has recognized that she will have to respond to the situation, perhaps gives some hope that people like myself and my colleagues can actually become part of the solution, rather than this very antagonistic stance at saying it's them and us. It doesn't need to be that way, and we do have the solutions. It's not like we don't know what to do. It's just to get the parties to be working.
And I think off the bat, the very basic things that can be done is to have running water and electricity to our hospitals. I mean, you don't even need experts in your field for that to be provided. That is just a basic job that falls within the realms of the municipality, I would assume. Now, I remember at the time, or just a few days after Dr. De Meyer's letter was published, you spoke to my colleague Sally Burdett one evening, and you spoke very warmly about the Dr. Tim de Meyer that you knew. And at the time, I thought it must be reflective of many such interns that you worked with all those years ago who've gone on now to become experts in their field. I believe Dr. de Meyer is one of only 10 in his field, in his specific field, specialists in the country. These kinds of stories cannot probably help you get the message out to try and encourage youngsters to follow in Dr. de Meyer and others' footsteps, to give their life to providing health care to those who need it most. That is, I suppose, in as much as it's not the most important factor right now, it is an offshoot of these kinds of stories that happen and are out there in the public domain for so many to see.
Yeah, fortunately, people still want to become doctors. Young adolescents and young people want to still become doctors. But when we see the kind of situations that the Dr. de Meyers face themselves, it does discourage them. The good thing is there are many, many Dr. de Meyers out there, passionate individuals who are willing to make the difference, who go every day into their job, not saying, it's a job, what can I do, how quick can I get home, who are there to make the difference and to make sure that the care they provide is of the best quality. And fortunately for us in Gauteng, and certainly in the country, we still have a whole generation of these young doctors who are still passionate, despite the awful circumstances we work with. And as long as we have that cadre of individuals, there's still hope for the health system. So young aspirant medical doctors don't have to despair. I believe that we still will overcome, and that the situation that Dr. de Meyer finds, we can still reverse.
Well, on that hopeful note, thank you so much for your time this evening. Professor Haroon Saloojee is Wits University's Head of Community Paediatrics.